it's a Chinese, the reishi, right. And so there's different colors of reishi, but at any rate. Used for centuries by Chinese is Siberian ginseng. This is not regular ginseng, okay? It's a different herb.
It's a different herb. This is Eleutherococcus senticosa. It's not even Panax ginseng. It's not even the same family.
Right. So just because it says ginseng, it's not ginseng. Like normal.
Actually, we should take. I should change the name anyway because they don't call it. They completely changed the nomenclature in the Western pharmacopoeia to Eleutherol.
Okay, so, but this is the common name, or it's also called Eleutherol.
Yeah.
And that can be used daily. Melodia, this is something, again, this is a generalized one. It's not specific to H1N1, so I'll go through it quickly. Okay, over-the-counter preparations, like airborne and things like that. Okay. Some of the nutritional preparations can be useful for cold and flu prevention and treatment. Combination herb and nutritional supplements may not be appropriate for some people. Actually, some of these things like, what was that, the airborne or whatever, it had like NutraSweet in it. Like these are like neurotoxins. So, I guess it was developed by a teacher, but at any rate. But apparently they put, neurotoxic substances that are not necessary in it. They use a traditional Chinese medicine formula, but that particular formula is not one that's been successful in China in treating H1N1. There are other formulas in the Chinese literature now that have been successful, but those are not available over the counter. And by the way, Andrographis is one of the herbs.
And you get so little of it,
Right, and it's very little. You'd have to eat a whole box.
I take a whole box of that stuff to be able to really.
And then you'd probably get toxic from all the nutrition. Okay, so it is best to consult with an experienced herbalist. But again, if you're going to self-prescribe, just use common sense. If you don't feel right on it, something's wrong. A lot of the people who died from taking, some like a Ephedra or something like that, they had lots of symptoms before they just dropped dead. They just said, oh, it couldn't be from, this. It had to be something else. So, herbs are very safe if you use common sense. All right, and it is better though to use an herbalist. Herbalists, like in our practice, if we have any questions, we check people's pulses. We can feel when things start going wrong, or we can order certain blood tests to make sure their liver and kidneys are doing okay. If we, for people who, who are far away and can't check their pulses or whatever. Okay, other ideas. Very useful to treat the local environment. Okay, so now we're talking about, H1N1 can spread airborne, right? It can spread through surfaces, but also airborne. So one of the defense mechanisms is we want to use something that can be airborne to help stop it, right, if you're in that kind of environment. So essential oils are very good for that. Tea tree oil actually has some research that it can kill H1N1. Peppermint, ravensar, and eucalyptus, as far as I know, have not been studied yet with that, but they are all very good antivirals in general, broad spectrum. And since 80-some% of what you're going to come in contact with, or actually 98% of what you're going to come in contact with is not H1N1, it's a very good idea to use a type of blend. And this is one blend, Steve's our resident essential oil expert, that he has put together that can be broad spectrum and accessible to most people.
Yeah, that specifically is very broad spectrum on a variety of different viruses and bacteria, so very useful. And then grapefruit seed extract.
And then intranasal care. Why? Why are we talking about intranasal care? 2 reasons. Actually, when they find a lot of these viruses and bacteria, they colonize in the nose, right? So if you can clean the nose out regularly, you can help prevent. Okay, I'm almost done. Thanks. We can help prevent we can help prevent it from replicating. Because there's usually a time period where it's incubating. So the nose can be one of the places where it incubates. And so using a nasal spray, especially when it has grapefruit seed extract in it, for example, because grapefruit seed extract has a broad spectrum antimicrobial activity. So that's something to consider. You can also use saline rinses. You can do, the nasal, things like that if you don't like, grapefruit seed extract or don't do well with it. But that's something that everybody should be doing regularly. And if you're at work or whatever, it's very easy. You carry, I probably have some right now. You carry these things around with you, and if somebody, coughs on you, sneezes on you, and you're germophobic, then you can whip it out and then just, squirt it up your nose a couple times and you're fine. Also, I personally carry around Ravensara or something like an essential oil. That's another thing you can do is carry it around. And then, if you're around a lot of people who are sick, because that happens sometimes when you work in a medical clinic or in a hospital. I work in Children's Hospital one day a week. there's a lot of sick kids in Children's Hospital, clearly. You just, smell it a lot because it goes right into your nose, and the molecules off of this will kill things. And it also goes into your lungs when you're breathing it in. So it's hitting these in a lot of areas of first line of defense, and that's the same with the nasal sprays. What's that?
What's the name?
The name of
It's
the
Ravinsara,
oils?
essentially.
This particular one's Ravinsara, but you can use peppermint.
Use any of
good.
those.
One of my teachers, he uses peppermint all the time when he travels and things like that. So if any of you are familiar with Jeffrey, I know he travels a lot with peppermint, so that's very effective.
If you're doing maintenance with the nasal rinse, how often would you do that? I know you're saying if you get in contact with someone, which happens a lot now, but if you're just doing maintenance, how
Personally, I'm not sitting there all day long, squirting it up my nose. I do it if I'm around somebody, comes up, says, oh, I'm not sick, and then they start coughing on me, which is very common.
People are susceptible.
I have allergies, and then they cough on you, and they say, oh, it's just allergies, don't worry. These things always start looking like a little, sneezing, a little cough. Oh, it's nothing, I don't have anything. That's when you can, so then you just go ahead and, do a little bit.
And then people who are susceptible to upper respiratory infections, sinus infections, I usually have them do it, if they're not in between, maybe one squirt a day or something.
Yeah, if you do it before you go to bed or something, at least you're helping clean stuff out that you've accumulated during the day.
Because it's actually also antifungal, and a lot of people who have these upper respiratory infections have a low-grade fungal infection in the sinus. So, and that also creates a lot more mucus production. There are sugars in the mucus that the bacteria breeds on. So that's where you get the sinus infections from. So,
Okay, so in summary, we're done, went over a little bit, sorry. Both herbs and foods can be used effectively to increase your immune response and decrease your likelihood of infection. Working on your immune system can also help decrease the severity and length of symptoms in the event you do get sick. And because we're all unique, it's best to consult with an experienced healthcare practitioner to determine how your individual needs should be addressed. And this is something, like our patients, we recommend they come in seasonally because at the season we can start checking around. Okay, we check your pulses, we palpate around all these places, in your body where it can show us where things are developing. And we can make specific recommendations for you for that season. So, otherwise you can use the shotgun and guessing approach, which a lot of people do. You read something on the internet, and I have patients who come in with literally 30 things they're taking because they read every single thing that could help prevent the flu, and they're taking every one of them, and that's actually causing problems for the body because it's creating toxicity. The body has too many things to deal with, and then it's actually weakening them rather than doing what they want it to do. So, something to consider. Thank you guys for coming. And any questions? Yes?
You said that you shouldn't take the adaptogens once you get sick, right? But didn't you also say that at the beginning, if you increase your dose as soon as you get sick, that can be beneficial?
Well, okay, you're actually, just conceptually, you're taking a risk, right? If you're starting to get sick and you take an adaptogen, because your immune system versus the pathogen might be like, the ratio might be like this. So you're taking a risk that when you take it, if it's already started, you're boosting your immune system up to here to really squash it, right? But it could also boost this up. So I personally recommend adaptogens only when you're in prevention mode, you don't feel sick at all, or when if you do get sick, and like, for example, H1N1, fatigue, and some of the patients who I've seen who had H1N1 or something similar to that have been like wiped out, like severe fatigue, like they barely can get. That you need to give somebody something to get their energy going back again. So that's something where you're balancing, the body's too weak and the pathogen's too strong. You have to build the body up. So that
would be later in the illness.
What's that?
That would be later in the illness.
That would be later on, and you're not going to want to self-prescribe when you're feeling like that. Yeah. So, but for example, as Steve mentioned, he will use certain adaptogenics, like the ones he put up here. The Eleuthero, the Siberian
and astragalus, the literature seems to suggest that they're actually very beneficial during treatment.
So, and astragalus, so those are ones.
The infections. So those two I would definitely consider. But I wouldn't consider ginsengs. The ginsengs I wouldn't use. Unless, like Brandon said, the patient was really depleted and they really needed it.
Okay. And then the vitamin